What's new about PIRA and important is that we're picking it up earlier and earlier in some patients in the disease course. And that's a critical determinant as we start to look at various therapies.
I think it is important to recognize that the risk factors for developing MS are not necessarily the risk factors for a worse prognosis when having MS.
EBNA1 is indeed the immunodominant antigen in the dysregulated response to EBV in multiple sclerosis. And this is good news.
We don't really know when this risk of postpartum relapse is set up. We know that there are immunological changes within the mother that occur prior to childbirth that probably set up this risk. And we also know that there's therapeutic lag with disease-modifying therapies. So as a neurologist, sometimes it can feel like you're stuck between a rock and a hard place.
I think there's no sort of smoking gun evidence that it is remyelination that is leading to progressive disability.
Direct from Copenhagen, in Denmark, you're listening to the ECTRIMS podcast, the official podcast channel of the European Committee for Treatment and Research in Multiple Sclerosis. I'm your host, Brett Drummond. Welcome to this special Congress series. ECTRIMS is always a melting pot of researchers, neurologists, nurses, industry professionals, and allied health professionals from around the world. This year is no different, as more than 8,500 people have converged on Copenhagen for the 40th anniversary of the ECTRIMS conference. The theme for this special event? Dedicated to the dedicated, a reflection of the unwavering efforts of all in attendance to create a better world for people living with MS. In this episode, we bring you the key highlights of Day 2 of ECTRIMS 2024. Today, I'm joined by Helme, Head of Research and Access at the Multiple Sclerosis International Federation, or MSIF. Anne, thank you for joining me.
Thank you for having me.
So I think to start with, for people listening who may not know about MSIF, can you tell us a little bit about what MSIF is and who you are, and why a conference like ECTRIMS is important for your overall mission?
Absolutely. So the MS International Federation is a network of patient advocacy organizations from around the world. We have almost 50 members from different regions of the world and links to many others. And our mission is, I suppose, very similar to all of our member organizations, is around ending MS forever. We want to make the world a better place for everybody affected by MS. So within that, there are a number of sort of programs and activities that we get involved with around research, around access to MS healthcare, around strengthening and connecting all of these MS organizations across the world.
And so a meeting like ECTRIMS is obviously a perfect place for everyone to get together from around the world. As I said, we've got people converging, so I'm guessing there are a lot of meetings that happen for you outside of attending scientific sessions. What does conference look like from your perspective around that ability to collaborate with all of these people?
Absolutely. I think the ECTRIMS Congress is probably a highlight of the year for both, I suppose, MSIF as the secretariat for all of the MS organizations who are our members, but the individual MS organizations themselves. As you say, it is a key place where we can come and meet in person our colleagues who we are normally interacting virtually with for the rest of the year. It really helps to strengthen these global collaborations that we have, learning new ideas, keeping up to date with all the latest research that is relevant to MS, and as you say, lots of meetings. So for me personally, each day will be a mixture of meetings with colleagues from other MS patient organizations, meetings with funders, with some of our clinical or research collaborators that we're involved in joint programs with, as well as getting to attend sessions whenever I can, because that's where some of the really exciting stuff happens in Maryland.
It sounds like a very hectic meeting for you, so thanks again for making time to do the podcast with us. Shifting into the scientific sessions, it was another huge day today, and for people here, we obviously have an understanding. For people who can't be here, we have so many concurrent sessions running at all times. Today we had topics ranging from remyelination, imaging, role of infections, genetics, emerging therapies, PIRA, comorbidities. I could go on and on and on. For you, obviously we can't attend all of those. What was the session that you attended that you found the most interesting today?
So for me, the session I attended this morning, which I was really inspired by, was the Meet the Experts session on kind of global aspects of diagnosis, particularly actually around differential diagnosis. And I think this is an absolutely brilliant session at the ECTRIMS Congress, and went to a similar one last year, which was why I was very excited to come back to this, because you get so many people from different countries around the world, practicing neurologists who are sharing their real life experiences of, well, in this case, trying to diagnose somebody who has very complex symptoms, and, how do you determine which specific condition they have? And to have then, for neurologists from around the world, to have the opportunity to bring some of these actual cases and to quiz world-leading experts, I think is incredibly valuable. So this session was led by Dr. Brenda Banwell from Johns Hopkins University and Dr. Mohammed Ali Sarayan from Tehran University, who come with different perspectives in terms of their own areas of expertise. But I can say that as both of them are very close collaborators with MSIF, with Dr. Banwell being our current chair of our medical board and Dr. Sarayan being part of the executive committee of our medical board, I feel confident in saying these really are world-leading experts who are very passionate about improving healthcare for everybody with MS, no matter where they live in the world. And so in terms of, I suppose, what kind of happened during this session, we kind of started off with an overview of the latest research and how that is actually getting translated into clinical practice and care, and what are some of the consensus and the guidelines and the tools that are available for practicing clinicians to try and distinguish multiple sclerosis, NMOSD, MOGAD from a lot of other conditions. And it was clear, just the challenge is huge. It is so complex. There are so many other conditions that mimic MS and other demyelinating disorders in part or in whole. And determining, the likelihood of something being MS, for example, when at a background rate in the country, the frequency of other conditions is going to vary a lot. But we don't necessarily know what those frequencies are because data collection and monitoring is very challenging in a lot of countries. From what we know, there is a lot of variation across geographies, but also across ages of patients as well, ages of people with MS. And our understanding of this is changing all the time. So with that as the background for a neurologist in a clinic to try and determine, okay, what is the most likely differential diagnosis? And also, what tests should I be using in this situation to help me do this? Are all things that, was the subject of lots of discussion in this session today. And why this is so important is because, and I think that this is a theme, I think, throughout this ECTRIMS Congress. Obviously, diagnosis is a really key topic, as we're hearing. But, we know that early treatment leads to better outcomes for people affected by MS and other conditions. And when you're talking about, say, MS compared to NMOSD and MOGAD, getting the right treatment is really important. Somebody being treated for the wrong condition can actually end up with much worse outcomes. So it is crucial for people with MS across the world. And the other thing that really struck me about this session is it really shows the importance of global collaboration and how ECTRIMS, across its wide range of initiatives, but this Congress in particular, facilitates that global collaboration and that sharing of expertise and experiences, and really enriching our understanding of these conditions and how to care for people with MS most effectively. And one of the things that stuck with me is something that Dr. Banwell said at the end. She made a call out to, I think, encourage healthcare professionals from some of the countries that are probably less represented at the moment in some of these shared initiatives and committees to join in and to see how they can participate and lead some of these consensus building initiatives and make sure that experience from all regions of the world is really feeding into our common understanding.
Actually, I really love that that's the session that you've focused on to start with, because I think it brings together in one session everything that is great about ECTRIMS. It's bringing people from all around the world. It's bringing people from a range of different disciplines where the messaging is important for everyone to hear, and it's dealing with a topic that is hugely important for people living with MS and other conditions. Thank you for sharing it. It's really, really interesting. Beyond that, I know you went to another session today that's quite different in terms of the scope. Can you tell us a little bit about what that one was?
Yes, I'm happy to. So the session that I have just come from was focusing on patient-reported outcome measures in MS. And as you say, different topic, but a very underlying common theme about the importance of global collaboration. And this topic is one that is very close to and important to MSIF and our members, because to set the scene a little bit, we are part of the Global PROMS Initiative, which is a collaboration between MSIF, the European Charcot Foundation, and the Italian MS Society, which is really taking the leadership for this whole initiative. And this was, mentioned at various points during the session as well. But what the PROMS initiative is really trying to do is to take that global approach and bring together lots of people who are passionate about the importance and the value of using patient-reported outcomes across research, across the clinical care for people with MS, self-management, and how they can be used in health policy decision-making as well. So there's a whole spectrum. And there were quite a lot of topics that were discussed, many presentations. What I took away from this is that, patient-reported outcomes, they are being used, but they are being used as outcomes in clinical trials, usually secondary outcomes. They are being used by people with MS for self-monitoring. But there are challenges in terms of the current status quo, in terms of measures. Not all of them are as good as each other. We don't always know whether they are measuring what is really matters to people affected by MS. And one of the points that was made is, sometimes this data is collected or requested from people with MS as part of their clinical encounter. But is that data, is what they are sharing being listened to and acted on? So that kind of importance of measuring the right thing and then doing something with that. But I think what is very hopeful and promising is actually hearing some of the studies that have been involving patient-reported outcomes and really thinking about where this whole field is heading. So, for example, how can we make the collection of patient-reported outcomes as I suppose, painless as possible for the people that are being asked about them? So instead of a very lengthy questionnaire that might take a lot of time to be filled in, how can we be more flexible and adaptable with that? How can we integrate some of the measures which are commonly used in registries and research and trials with data that can be more passively collected through smartphones or smartwatches, and how can we integrate all of that together to give us a really good picture of how a person with MS how are they living currently? How are they able to engage at work, in society, and so on? I mean, patient-reported outcomes can measure so many different things. But yes, how can we get a really good picture of how somebody is currently feeling and operating? And then, very importantly, how can we measure changes over time? And this is very relevant because in a clinical encounter, people may only have an appointment with your neurologist every 6 months, every 12 months. That's just a snapshot. What you want to see is that changes and fluctuations over time, and to get a sense of, is there any progression? Is there worsening? And so, there are some signs that actually by using patient-reported outcomes, we are able to detect progression independent of relapse activity or PIRA. And so this is where I think, patient-reported outcomes are going to have real utility in that ongoing monitoring of treatment efficacy and a person's state over time, so that the most effective healthcare decisions can then be made for a person. And then added into this is how can all of this be supported through digital technology? And obviously there are challenges when it comes to using digital technology as well. There are, people have different types of phones or watches. There are a multitude of different apps. One of the presentations was talking about a survey of current e-health tools that collect patient-reported outcomes relevant to MS. And they are very varied as well in terms of the types of symptoms they are recorded and how they are used. And, I think there is a lot of benefit in terms of, again, how digital technology can make that collection of data easier, how it can enable sharing of data between a person with MS and their healthcare team or into research studies. But again, we need to be sure that what the patient-reported outcomes and the measures we're using are the right ones, that they are meaningful, that they are reliable, that they are valid. And I think there really is, there is the sense within the community that we need to come to some consensus around these. Out of the measures that are currently available, what are the ones that are the best ones that we should be using? And can we get some standardization so that we can get comparison across clinical trials and research studies? And so that we can really, we've got enough people using the same measures so that we can really test out, how is this working in practice, in trials, in the clinic? How can we, can we test out, how are we going to overcome some of the barriers of potential adherence to using technology and measures, the acceptability from the healthcare professionals? Are they comfortable about having some of these conversations in the clinic with a person with MS? There are lots of challenges, but from my work with the PROMS initiative, I know there are a lot of very enthusiastic and committed people to drive this forwards. We know that in a different condition, Duchenne muscular dystrophy, they have a digital outcome measure that has been accepted by regulators as an outcome. So, we have something to aim for in MS as well.
Once again, it's the same as what I said about the first session. I think you've really hit on another topic that is key to ECTRIMS and works really well. And we didn't pre-design this in terms of the sessions that you went to. You've done this completely of your own accord. But I think this, again, fits in with one of the key messaging points of the conference, which we're building more upon, which is in getting people living with MS and the MS community and other neurological conditions engaged in the research world, that they need to be part of what is happening here, that their lived experience is a really important part that we need to include in our research studies, which I guess is highlighted by tomorrow with the Patient Community Day event that we'll be having, that they will obviously be involved in and a central part of. Thinking about tomorrow, what are you most looking forward to for the final day of ECTRIMS 2024?
So I'm not sure I'm going to be able to pick just one, so I might cover about
pick
three
multiple.
very
Go
quickly.
For it.
So one of the sessions that I always enjoy the most at ECTRIMS is the session where representatives from all of the other regional TRIMS organizations come together and present around a combined topic. So again, there's a focus on diagnosis tomorrow, but I suppose with MSIF having a global outlook, the TRIMS are, and including ECTRIMS, but all the regions as well, are really important partners for us in our work, making sure that we are hearing about the different types of challenges in different parts of the world and working with them, that when we have initiatives that we want to have global impact, that we are doing so in collaboration with all of our regional partners. So I always really enjoy going to that session. And very excitingly, this is the first time that the newest regional TRIMS, Afric TRIMS, is going to be featured within that session. And yeah, I think that's a big change. That's an area of the world that hasn't really been hugely represented in the MS community. And, from a position of, I don't know how many years ago, of people thinking, well, there's hardly any multiple sclerosis in the African region. And we know that's not true. We don't have the healthcare resources and the ability to diagnose it. So it is there. There are more neurologists getting more interested in MS, and there are some big challenges to work on in that region. So that's one of the exciting points. Of course, all of the late-breaking news, late-breaking research is another really interesting session. So there are some very important trials that we'll be reporting, and I think everybody is eager to hear more about the science behind some of the headlines that we know about. And then, of course, you mentioned the Patient Community Day. And again, for me, this also highlights the importance for MSIF, or the importance of the collaboration between MSIF and ECTRIMS. Because I was reflecting on, in the opening ceremony, you had the wonderful video about the start of ECTRIMS and when it started for. And some of these really key researchers and clinicians at the time, they were also connected with MSIF's medical board. And MSIF is a little bit older than ECTRIMS, but, some of our shared history goes a long way back. And, we are really proud of our ongoing collaboration and our mutual support of each other. And, I think this is really shown by something like the Patient Community Day, where, MS organizations, we are the ones who, I guess, connect with people with MS and affected by MS across the world. And it's that recognition that, you can't do really effective research unless you were talking to people with MS about what matters to them and, what are their biggest priorities and challenges, and how do we actually go about doing the research. So again, this is something that is changing over time, but I think as MSIF, as all of our, our member organizations, the MS organizations, this is something that we are really passionate about, is involving people affected by MS in research and doing it as effectively as possible.
Yeah. Well, I think that's a great note to finish on. Look, thank you, Anne, for joining us today, for sharing all of your insights across what was a very busy day and a busy conference for you. And thank you for all of the work that you do at MSIF and all that MSIF does to contribute to ECTRIMS every year.
Thank you.
And thank everyone for listening. Please join us tomorrow as we continue with this special ECTRIMS 2024 series, highlighting all the essential research elements of the day. Once again, I'm Brett Drummond, host of this podcast episode and co-founder of MS Translate. The ECTRIMS podcast is produced and hosted in collaboration with two key partners, MS Translate, an independent resource centre that aims to simplify the complex wealth of information about MS for the greater MS community, and the MS Journal, a peer-reviewed international journal that focuses on MS, neuromyelitis optica, and other related autoimmune diseases of the central nervous system. The 2024-25 ECTRIMS podcast series is supported by educational grants from Alexian AstraZeneca Rare Disease and Novartis. Educational grant providers have no input in the podcast content. You can subscribe to the ECTRIMS podcast on all your favourite podcast channels, including Apple and Spotify. Visit the official ECTRIMS 2024 website to learn more about the ECTRIMS Congress and join the conversations on X, LinkedIn, Facebook, and YouTube.